Hello, everyone. Good morning. I'm Chris Bredesen, President and Chief Operating Officer of Multicare Good Samaritan Hospital. With me is Dr. David Bachman, the hospital's Chief Medical Officer. Thank you for joining us this morning. Our goal today is to help our community gain an understanding of a patient safety situation that has local public health implications. Earlier this year, 2 unexplained cases of hepatitis C were documented in Pierce County. Hepatitis C is an infection of the liver that is usually spread when blood from a person infected with the hepatitis C virus enters the body of someone who is not infected. It is most commonly transmitted by exposure to an infected person's blood through shared needles. As with all reports of hepatitis C, this triggered a local public health investigation to determine the source of the infection. Rates of hepatitis C have increased locally and nationwide in recent years, largely as a result of the opioid epidemic, leading to increased monitoring by local, state, and national health departments. The investigation, in coordination with Good Samaritan Hospital, revealed that both patients had received injectable narcotics in December of 2017 from the same healthcare worker, an emergency department nurse at Good Samaritan. A genetic test confirmed that the 2 cases were related, indicating a common source of the infection for both patients. Through the investigation, we also learned that the nurse was removing higher than normal amounts of narcotics from our dispensing system. The nurse subsequently admitted to diverting medications intended for patients. She tested positive for hepatitis C and no longer works for Multicare. She worked in the emergency department from August 4th of last year until March 23rd. We've identified about 2,600 patients who received injections of narcotics, antihistamines, or sedatives in the emergency department when this employee was on duty. We're notifying these patients with letters that should begin to arrive in the mail today. We believe the overall risk for these patients is low. However, only with laboratory tests can we know for sure whether anyone else was infected. We encourage everyone we notify to be screened for hepatitis C, which we are offering at no cost to this group. Our investigations so far have not, I repeat, have not indicated that any patient was exposed to hepatitis B or HIV. Despite this, based on the recommendations of the U.S. Centers for Disease Control and Prevention, we are also offering testing for the hepatitis B virus and HIV. Good Samaritan will also provide any related follow-up or treatment at no cost to the patients. This event should not have happened in any of our facilities, and the fact that it did is inconsistent with our values of respect, integrity, stewardship, excellence, collaboration, and kindness. This nurse's actions violated our organization's values, and because of this, we violated the trust we have with our community. We sincerely apologize to the 2 patients infected and to the patients who now need to be screened. This population represents less than 5% of the 54,000 patients treated at the emergency department during the identified time frame. I want to be clear about this. 95% of the patients who visited our emergency department during this time are not affected and are not at risk from this situation. The only patients who need to be tested are the ones who will be receiving a letter from Good Samaritan this week. Any positive test results will be reported to the Tacoma-Pierce County Health Department, which will work with patients directly to identify when and where they were infected. They will also help with next steps, which may include follow-up testing and treatment. We will cover the cost of treatment for any cases linked back to Good Samaritan. Hepatitis C treatment has evolved significantly in the past decade, and the disease is now considered curable. Most patients with hepatitis C can now be cured by taking a pill at home for 12 weeks or less with a success rate of 90 to 100%. We accept full responsibility for this situation, and have thoroughly examined our processes to see where we can improve to prevent this from ever happening again at any multi-care facility. We've strengthened our reporting systems to add to our already detailed information about medication use in our facilities. These new reports will help us easily identify if employees deviate from standard practices for medication use. We are closely monitoring these reports and have not found any evidence of other staff members who were withdrawing more medication than appropriate. We want to thank our local, state, and federal public health partners who have helped us investigate and understand this situation. We're a unified team when it comes to the health of our community. In closing, we want to be very clear that our current patients, as well as former patients who do not receive notifications, have no reason to be alarmed. Our confidence in our nursing staff and the members of our care team remains extremely high. I cannot thank them enough for all they do every day. We deeply value the trust of our patients and our community, and will do what is necessary to regain that trust by taking the appropriate and responsible actions on behalf of our patients.